So that endorsement just coming in the last few moments. Let's speak to Professor Lawrence Gostin, Director of the WHO Centre on Public Health and Human Rights. So let's to help us digest through this. This is an endorsement. What does that mean in real terms for this vaccine?
Well, in real terms, the U.S. Food and Drug Administration's Vaccine Advisory Committee makes a recommendation to the FDA. It's not legally binding, but historically, the FDA has followed its advisory panel's recommendations. It's very widely expected here in the United States that the FDA will, within a matter of days, will grant emergency use authorization for the first COVID-19 vaccine to be deployed in the United States.
And it was a very public way of discussing this. It was incredibly transparent, the kind of detail that many people in many other countries would have loved to have seen in their own nations.
Yeah, I'm really glad you brought that up because although I have enormous confidence in the British regulatory authorities, it wasn't as public and transparent as in the United States. I think it's a wonderful illustration that the United States institutions can be rigorous, thorough, and transparent, even as we were rushing toward a vaccine. And this is particularly important. I think I have to say this, that under the Trump administration, the CDC and, of course, the US FDA has been put under enormous political pressure. And I've said from the start that I think that the U.S. public health institutions will bend, but they won't break. And that appears to be exactly what has happened. I'm actually quite proud of what the FDA has done.
And so the committee voted 17-4 in favour, and the wording is that it outweighs the risks in adults 16 years and older of taking the shot. Talk us through that. Outweighs the risks, just in case that causes any alarm bells for any of our viewers.
Yeah, this is a very, very safe vaccine as far as we know. But the thing about vaccines, unlike medicines, is that when they are deployed, they're deployed to millions upon millions of people. And even the tiniest safety risks that you may never have anticipated could occur. We saw that with the allergic reaction to the vaccine in a couple of patients in the UK. And so this is really regulatory speak. It's to say we haven't found any safety issues, but on balance, the benefits are clearly outweighing the risks. I do believe that is enormous benefits and extraordinarily low risk, but that's the way regulators do it. We now have 3 stringent regulators from the UK, Canada, and the United States, soon to happen, that will approve this Pfizer-BioNTech vaccine. And that's great news for society. But now the hard work begins because we have to make sure that we can actually roll it out. People will accept it. We've got enormous logistical challenges, the likes of which the globe has never seen.
Well, on that note, the Centres for Disease Control and Prevention is advising that healthcare workers should get it first. Ultimately, I guess it's the state governor's decision as to who gets it first. Who would you be advising them to prioritise?
Yeah, and I have been advising. I absolutely think that health workers and people in long-term elderly care facilities should get priority. There are good reasons for that. In healthcare workers, the ethics are that first they are at very heightened risk. Any kind of a coronavirus, we saw it with SARS, MERS, and certainly now with SARS-CoV-2, that they are at great risk. But more importantly, we need our health system to function. Right now, I think it's no secret that the United States is going through an unprecedented crisis with huge spikes in hospitalizations and deaths. The hospitals are on the brink of collapse. We need to keep the health workforce on side, healthy, safe, and focused. That is job number one from an ethical and legal point of view.
And when it comes to the cost, explain to us, it should be free, but of course with the health insurance system that you have, what happens to the people that don't have health insurance, the many that don't?
Well, this is always a big problem in the United States. I will say that that the White House has already said, and our Department of Health and Human Services, that this will be a free vaccine. I do believe that it will be. But you still have problems with a broken healthcare system like the United States does, because people, who are not insured, immigrants who are afraid of being deported, may not turn up for their vaccines because they're afraid of the cost, because they don't know it's free. They're afraid of deportation. They're afraid of law enforcement. All of these things are huge challenges, and that's why it's always better to have a national health system the way you do in the UK than the fragmented system we have in the United States. Absolutely is going to be a barrier for us.
Well, on that note, we're going to leave it there. It's been really good to talk to you on this, which will become a historic day. Professor Gostin, Director of the WHO Centre on Public Health and Human Rights, thank you so much for your expertise.
I'm most grateful. Thanks.